Subscribe now for easy-to-understand health tips, Dr. Madam. Waking up in the morning, as soon as your feet touch the ground, you suddenly feel a sharp pain. By the end of the day, the soles of your feet are burning as you walk. Gradually, this is a kind of pain that at first doesn't seem very important, but over time, even walking becomes difficult. Foot pain doesn't come with a loud warning, it comes quietly. It changes the rhythm of your movement and makes you realize that your body is trying to tell you something. Today, in simple terms, we will learn about the common causes of foot and heel pain, why this pain occurs, and what signals the body is actually giving. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, a diabetes and hormone specialist. Let's start with the heel, because most pain begins there. The most common cause of heel pain is plantar fasciitis. There is a thick tissue at the bottom of the foot called the plantar fascia. This tissue runs from the heel to the toes. When this tissue becomes inflamed or damaged, pain occurs under the heel. This pain is usually felt more after resting. During the first few steps in the morning, it feels as if there is a thorn under the heel. After walking for a while, the pain lessens a bit, but by the end of the day, it returns again. Pain can also occur at the back of the heel. This is often due to problems with the Achilles tendon. This tendon connects the muscles at the back of the leg to the heel bone. When there is inflammation here, climbing stairs, walking on elevated surfaces, or standing on your toes becomes difficult. Sometimes the Achilles tendon can suddenly tear. In this situation, there is a sudden, sharp pain and difficulty walking. This is a medical emergency. Now let's talk about the front part of the foot, that is, the ball of the foot. When there is pain here, it often feels as if something is stuck inside the shoe. Excessive pressure or prolonged use can cause small fractures in the metatarsal bones. Inflammation around these bones can also cause pain. Another reason is Morton's neuroma, where the nerve located between the foot bones gets compressed. This can lead to shooting pain, burning sensations, or numbness. Tight shoes can make this pain even worse. The structure of the foot is also important. If you have flat feet, pain can occur almost anywhere in the foot. Some people may not have any symptoms at all, while for others, the pain gradually increases. Children can also experience heel pain, especially if there is inflammation in the heel's growth plate between the ages of 8 and 14. In Sever's disease, the pain increases after running or jumping and decreases with rest. Not all foot pain is caused solely by foot problems. Different types of arthritis can cause pain and stiffness in the joints of the foot. In the case of gout, there is a sudden, intense pain, redness, and swelling in the big toe. In the case of bunions, pain gradually increases at the base of the big toe. Nerve problems can cause burning, tingling, or numbness in the feet. With diabetes or vascular issues, reduced blood flow to the feet can lead to pain. Now, let's return to plantar fasciitis. This condition is usually diagnosed simply by talking to the patient and examining the foot. Special tests are rarely needed. Recovery takes time. It usually takes anywhere from a few months to up to a year. This tissue heals very slowly. However, patience and regular care help a lot. Rest is very important. You need to reduce running, long periods of walking, or standing for a while. It's best to avoid walking barefoot on hard floors. You should have good shoes that are soft and provide proper support. Old worn-out shoes can worsen the pain. Heel pads or arch supports help reduce pressure. These should be used inside the shoes. To relieve pain, common painkillers or anti-inflammatory medicines can be effective. Applying ice packs also provides a lot of relief. Stretching is very important. If the muscles at the back of the leg are tight, it puts strain on the heel. Regular gentle stretching reduces this strain. Rolling the sole of the foot over something round can also help. If none of these methods work, then other treatments are considered. Steroid injections, shockwave therapy, or night splints can help in some cases. Fortunately, most people recover completely over time. To prevent this problem in the future, it is very important to wear good shoes, stretch regularly, keep your weight under control, and avoid excessive exercise on hard surfaces. Foot pain does not mean weakness. It is a warning signal from your body. If you take care and give it time, your feet will return to their normal rhythm.